Are there any specific breeds that need more care in the beginning? They need more specific work?
So that's an excellent question, and yes, absolutely. There are certain breeds that are very much more prone to certain diseases, so we want to make sure that we're doing the preventative care for those diseases. So any of the brachycephalic breeds, so that's going to be your French bulldogs, your bulldogs, anybody with a squished face, their teeth don't meet properly, so we want to make sure that we're doing more aggressive cleaning on all sides of their teeth. The pink part of the gums that's around the teeth, that's called the gingiva. And it overgrows in those breeds. It's genetically linked, not anything that anybody's doing wrong or anything like that, but we do see that, and we want pet parents to really keep an eye on that. And as soon as they do see that, and especially if they see that there's getting food stuck down in there, we need to address that early. And then for other breeds, so we're seeing a lot of the doodles, as you guys know, lots of different types of doodles. And with poodles, they tend to have a bit more of a narrow bite, which means that their canines sit a little bit closer together rather than further out on the mouth. And with that, we actually keep a close eye on them when they're puppies to make sure that the canines are coming in properly in the right area. There's some of them that their bite is too narrow and the canines are actually affecting their hard palate, which is the hard part that sits right behind your teeth. Dachshunds specifically tend to have issues with the inside of their upper canines. The one and only breed that has that problem.
Do they get two that come in?
Sometimes you get the baby teeth that are still there. That's a kind of a separate problem, but they don't have thick enough bone on the inside of those upper canines. And we can end up with problems called an oral nasal fistula as they get older, which basically means that we have periodontal disease that goes from the mouth up into the nose. So we have to be really careful with making sure that we're addressing any tartar that they're getting on those canines and checking up inside those upper canines.